Are you overwhelmed by the endless options of supplements out there? In today's episode, we're diving into the supplements that women like you have asked about most, and the ones our Menowave care providers have recommended. From vitamins and minerals to herbs and beyond, our experts break down what works, what doesn't, and why. Whether you're looking to manage menopause symptoms, boost your energy, or just feel better overall, this episode will give you the guidance you need to make informed decisions. Keep listening to this episode of the Menowave Lounge for expert advice that cuts through the noise. Welcome to the Menowave Lounge, hot flashes and cool conversations. In today's episode, we're diving into the world of supplements for menopause by looking back at some of our previous episodes with our Menowave care providers who shared their expertise on the supplements that can help women through this transformative time. From Chinese medicine to cutting through wellness misinformation and even finding solutions for vaginal pain and dryness, we've got it all covered today. Let's start with a look back at episode 5, where we spoke with Kimberly Marin. She introduced us to the concept of yin-yang balance in Chinese medicine and how it plays a role in harmonizing the body during menopause. Kimberly shared some fascinating insights on how herbal supplements can support this balance and provide relief from menopausal symptoms.
Unfortunately, we're at a point in our country where our soil is very depleted. And the nutrients that are available in our food today, even organic ones, are not even anywhere close to the nutrients that were in the same food in the 1950s. It's because they haven't cultivated the soil properly. They've just drained the soil. They haven't crops and done crop covers to help keep the minerals into the soil and keep the soil healthy. So coupled with the fact that the diet the foods available in especially in the United States are pure garbage, unless you're eating a real whole foods diet where you're just doing like fruits and vegetables and proteins, and you're staying on the outer aisle of the grocery store and you're not going down the other aisles where it's all processed food. Even then, you still need a good supplement. I'll tell you what I take every day, just as general supplements for anti-aging. I always take N-acetylcysteine because that can improve glutathione levels, which is what helps your liver keep everything clean and detoxified. And it's also an antioxidant that's really important to the body. I also take multivitamin with minerals because most of the population is deficient in magnesium. Magnesium is a really big component of not being able to sleep, of having like muscle pain and cramping. I also take mushroom formula every day to help with anti-aging and just overall brain health. There's some really good mushroom formulas out there. You want a little bit of everything, a little maitake, a little reishi, a little lion's mane. Lion's mane's the best one for brain. And they're also anti-cancer. So, you can't really go wrong with that. And then I also take a probiotic because gut health is so important, especially as we get older. Unfortunately, our digestion gets worse and worse as we age. We don't absorb as much. It doesn't work as well. We're not excreting as much acid in the stomach. We're not excreting as much enzymes in the intestines. So taking stuff to keep your microbiome healthy is really important. And the rest of it would be catered individually by what their patterns are. And Chinese herbal medicine is like a pharmacy. You can't just go and pick up a formula for yourself without knowing Chinese medicine. It would be like going and giving yourself a drug that's a pharmacy grade drug without having a doctor tell you that you needed that. You just don't want to do it, because if you haven't picked the right one, you can make your problem much worse. Because the way that Chinese herbs work, the way that they're categorized, they have properties. So they've got temperature properties. So there's hot, warm, neutral, cold, and cool. And then you also have flavors like salty, pungent, spicy, and those flavors do different things to the organs. So if you pick the wrong combination, you can make your problem much worse. And if you have, like, let's say you have high blood pressure and you pick the wrong one, you can make the high blood pressure go even higher. So I wouldn't be able to give you recommendations for specific Chinese formulas because that they really have to have diagnosed properly. Mm. The other thing that you can also take is CoQ10, which is a great antioxidant, and vitamin D is something that I take extra of. Like, it's in my multivitamin, but I take even more of it because the majority of us are deficient in it. And a lot of that has to do with some genetics. There's some issues with some genes that we can inherit from mom, dad, or both that make us more predisposed to be low in vitamin D, or maybe our detox pathways don't work so well, like the MTHFR or the COMT. So there's a lot of variations in what we might need to stay healthy, depending on if we've got these issues with our genetic mutations.
D is also good. I bump up vitamin D in the wintertime just because it helps with depression. We don't get enough sunshine in the wintertime, and vitamin D helps that. I also am a big believer of bumping up on my vitamin C's. I also take a borage oil, which helps with inflammation. You could also do like a fish oil. And there's different types of those out there. What do you think about collagen?
Oh, I love that. I forgot about that. I do that every day too. Like, that for me is a must. And I got to tell you, I definitely noticed a difference in my skin, in my wrinkles, and my nails, and even my hair when I started with the collagen. So I do take collagen. I take collagen and I take silica. So I do both of them. I will tell you though, if you get the silica, get the capsule, don't get the liquid. It is disgusting. It tastes like fish that's laid out on the side of the road for 5 days. It's really gross. And I have a bottle of it that I'm making myself finish, but I will never buy the liquid one again.
Oh, yeah. You know, I mean, and I take a lot of supplements too. I take the CoQ10, I take a probiotic, I take 100. That's a formula that helps with your brain function. I haven't tried the mushrooms yet. That sounds really good. And what was the first one that you said?
Acetylcysteine.
Yeah, I've never heard of that one actually before.
Yeah, so N-acetylcysteine, and another one that I forgot to say is alpha lipoic acid. I take both of those every single day. They are massive antioxidants. And like, especially alpha lipoic acid is very unique that it's water soluble and fat soluble, and it can cross the blood-brain barrier. So now we have protection like all over the place. Glutathione also is critical. It's antioxidant, but also really integral part of the detox pathway. Now, there are going to be women who add supplements for menopause. Like a lot of people ask me about maca. Hey, should I take maca? Does it work? Is it going to help? Well, so the great part about Chinese medicine is we have classifications for these herbs. So maca works on the kidney meridian and the spleen meridian. So if their problems are coming from a kidney or a spleen problem, they're probably going to have good success with maca. If their problems are coming from the liver, maca is not going to do anything for them. You know, so that's why you get women all the time who say, oh, I took this, it helped, it worked, it's great. And then someone else takes it and they're like, man, it didn't do anything for me. Because that herb is probably acting within the meridian that's helping one person, but the other person, that's not their problem.
That's really interesting. Now, we've talked a lot about all these different supplements and they're all really good. And I think women tend to get really overwhelmed, like, oh my God, that's so many things to take. Do you create like maybe a smoothie drink in the morning, or do you take them throughout the day, or are there different times that you take them?
Yeah, what I do is in the morning, I'll just pull out everything I want to take. I don't take them all at once. And I will just put them on my desk. And every time I sit down, I'll take one or two of them. I do a smoothie for the collagen, and I do N-glucosamine for joints. And it's just another little add-on to the collagen. But I have another formula, another smoothie that I do that I really need to get back to doing. It's one that pulls heavy metals, because that's also a really big problem at our age.
Right.
Like fish, right? That have high heavy metals. The longer they live, the more heavy metals they have accumulated. We're no different. So, at our age, we've accumulated these heavy metals throughout our life, and we need to do things to pull them out.
Next, we'll revisit episode 9 with Melissa Perkins, who took us on a deep dive into breaking through the sea of wellness misinformation. In this conversation, Melissa helped us understand which supplements can genuinely support your health during menopause and which ones to be wary of. So we all have talked about, and we see in the group, everybody wants a supplement and they want to know, well, who's tried this? What do you take? And someone inevitably will say, well, I took this and it was great. And you'll have 3 or 4 people like, oh, that didn't do a thing for me, or that was a waste of money. And then so someone's looking there going, well, I guess that's not going to work. Or, well, I thought about taking this, but so-and-so over here on the internet said it didn't work. First of all, I want to ask, why do women do that? And what would you like to tell them?
Yeah. The first thing I'll say is I get concerned when people think that what's going to work for you is going to work the same for me, because our bodies are very different. And with all of these things, there is no one size fits all approach to menopause, to exercise, to nutrition, to supplements. So kind of in a bigger sense, that's one of my big things that I tell my clients, and I just try to put out there. And then the second thing is, we are a society of wanting, I want results yesterday. And so I think a lot of people think that a supplement is going to be the key to their weight loss, or key to sleeping better, or key to not having digestive issues, whatever it is. We have to remember the word is supplement. The supplement is really important. We've lost the whole meaning of that word. There needs to be other things in place, and that can be an additional thing, a supplement to what they are doing in their lifestyle habits. So if you're not doing these other things, no supplement is going to be the magic pill to fix those other things if you're still not eating in a more healthy way. Doesn't have to be perfect, not doing some exercise or physical activity of some sort, not having a healthy sleep routine, or not managing your stress, whatever the thing is that you're trying to fix. I'm not against supplements by any means, but we also have to go into it in a different, again, here I am with mindset, right?
Right.
And our mindset has to be, I also need to be doing these other things. And then this might be the cherry on top to help me get there. So maybe you're doing a lot of great things, for example, with sleep, but maybe you're still struggling with a little bit of insomnia or whatever it is. And maybe you need something to help you fall asleep. And there might be something that is lacking or that can help you with that. But if you don't have a good sleep hygiene routine, the supplement can only do so much, or it might not work. It might have a different effect on you than maybe the majority of other people. That can happen too, where I might take something, I say, oh my God, it's the best thing ever. And then, Robin takes it and she says, oh yeah, me too, great. And then Marty takes it, she's like, I had the exact opposite reaction. And that can happen with a lot of things as far as supplements are concerned. And I will say supplements are a non-regulated industry. So people have to understand that there's no FDA overlooking what is actually in the supplement. Is what they say in the supplement really in it? Are there additional things in your supplement that maybe aren't so great for you, or that you don't even know are in there? Was the company reputable? There's a lot of variables there that can make a difference. And there are better brands and things out there than others. So I caution people, whenever someone asks me about a supplement, they want recommendations, they want some of my guidance, I will tell them, I will tell you what I know about it. I can tell you the science and what has been shown to be true so far, whether it even works or not, because there are studies out there that don't look at everything, but not every supplement. And then I will also tell them, you need to do your own research, and you need to also understand other medications that you're taking, medical conditions that you have, other things that we need to take in consideration that maybe your friend or loved one or whoever is taking something doesn't have, that might affect the blood pressure medication you're taking, or the thyroid medication, or whatever it is. So we have to do our own research. We need to make sure, if we have medical conditions, discuss it with your physician. Are there any things I shouldn't be taking? Or is this maybe not appropriate with a medication I'm on or a medical condition I have? and then go from there before just saying, oh, yeah, well, that worked for so-and-so. Supplements are a multi-billion-dollar industry, and they can't always prove that they actually are doing anything in a lot of ways.
Yeah, there's no guarantees.
No.
Do you have any kind of like recommendations that women should be taking as far as supplements?
Sure. I will say that when I have this discussion with a client, I will also say our first thing we want to do is get as much as we can from our food as far as our nutrients are concerned, our vitamins, our minerals. And then I'll use myself as an example. I have never liked fish. I just will not eat it. It's a texture, it's a smell. I can't. So I know I have to find other sources of omega-3 fatty acids because I know they're important. So I will supplement with something like that because I know I'll be deficient because I'm not getting enough from flax seeds or other things in my diet. So sometimes it takes an analysis when I speak with someone as far as looking at what does their diet look like? Are they deficient in certain things because maybe they are lactose intolerant, so they don't touch dairy? Maybe they're going to be low in calcium, so maybe they need a calcium supplement, or maybe they tell me they have some joint issues, so maybe they need something that will help with their joint inflammation and things like that. So sometimes it's difficult to give like general recommendations as far as everybody should be having this as far as supplements are concerned. But I will say some of the typical things that I see, vitamin C is a good one. It's great as far as inflammation. When people say have a surgery or are healing, it can help with that process. So that, and it is a water soluble vitamin. So if you get too much in your diet and with a supplement, you're basically just going to pee it out, any excess. So there's not going to be a buildup in your system like other kinds of things. Most people tend to be, especially Americans, tend to be low on the omega-3s. So a lot of times we get a lot of omega-6 in our diet, but omega-3, the ratio is off. So usually that's a pretty safe one to have people supplement with because they tend to be in our typical American diet. Even people who eat healthy tend to be a little low on that one. So those are a couple good ones. Collagen is very popular. It became popular a few years ago. That one is very interesting because there's a lot of people who say, oh, I notice a big difference. And then there are other people who said, I didn't really notice a difference. And then there's different kinds of collagen out there too. So it depends on what your goals are for the collagen and then what's going to work for that person too. So those are kind of interesting things when it gets to supplements. Is I get into my it depends answer as far as questions when people say, what should I take? Or is this good? I'm like, well, it depends. And then we have to kind of dig a little deeper to see what's really necessary for that person.
Mm-hmm. Good answer.
And then it saves them money too. I don't want people taking things and wasting their money on something that they really is not going to benefit them.
Finally, we're closing with a powerful discussion from episode 26 with Irene Hogan. Irene shared her expertise on supplements and other natural solutions for managing vaginal pain, dryness, and recurring UTIs during menopause, issues that so many women face but don't always feel comfortable discussing.
So we're going to talk moisturizers and lubes.
Excellent.
Good. So we need to explain there's a difference between lubricants and moisturizers. So lubricants help things glide. So lubricants are primarily for sexual intercourse, for toys and things like that too as well. And there's many different types. So the most common ones that I'm going to talk about is some are water-based and some are silicone-based. So the water-based often have glycerin. They have some other things in that too as well. And they basically are a lube. The silicone is a little bit more almost greasy in that too as well. Some women like them, but they can actually be very comforting in that too. And they last longer because they attach to the skin longer. They're totally safe to use, even with condoms and that too as well. But some of the lubricants, you've really got to look for what's in them. So although glycerin is okay short term, you don't want glycerin in products that you're using long term, which we're going to discuss about moisturizers. And there's other things like propylene glycol, and sometimes there's also additives or there's perfume in these too. And they can actually be irritating and they can dry out the vaginal tissue even further with extended activity. So that, as I say, is what a lubricant does. And women, because they have decreased moisturizer, as they go into menopause, it's probably they need to use that more than they used to. They're not going to have that vaginal lubrication that they have. And then we have vaginal moisturizers. Okay, so vaginal moisturizers is for that vaginal health. So even if you're not having, sexual intercourse, you're not in a relationship, although many women, do that, and then they have a new partner, and then they find that, they can't have sex in that too, and they wonder what's going on. And we can just talk about some of the tools for that too as well. So you need to have a moisturizer. So lubricants are obviously just used for sexual intercourse. But moisturizers is the same way that you would use a moisturizer on your face, which most women will do as they age because they want to get rid of wrinkles and things. So because the skin is thinning, we need to use a moisturizer on a regular basis. So these are meant to be used, every day, 2 to 3 times a week. And you also need to look at those and make sure they don't have additives in, they don't have things like propylene glycol in and glycerin. We also need to make sure that they're pH balanced for a woman. As we mentioned, the pH is very important in the vulvar tissue. And so you really need to read the labels and make sure. And also, there's a thing called osmolality, and we don't have to go back to our chemistry lessons in 12th grade for that. What it means is that some are too strong almost, okay? And so they actually will draw water out of the vaginal tissue, and they will make the situation worse, and they will call over drying. So basically, lubricants, as I say, for intercourse, and then you need to use a moisturizer for your general vaginal health to stop that burning, to stop the irritation, to stop being uncomfortable for you to wear clothes, to ride bikes. And then we can talk about estrogen. So should we talk about vaginal estrogen?
So this is really interesting as far as, because we've all heard what lubricants can do, water-based and silicone-based and that sort of thing. So, okay, yeah, a little bit of a common knowledge, but the moisturizers are more interesting. It's like, how do you pick something like that out? Because obviously you're not going to use the same thing on your face. You're not going to use down there, right? Yes. Irritants. Castor oil, that's kind of like the big thing these days. Everybody's using it on their face. Is that something that you could use down there, or are there different products? What do you look for when you're looking for a moisturizer for your vagina?
Normally, you want something that is for the purpose. So it should be for vaginal use. As I say, you want to make sure there's not those additives in, propylene glycol. You don't want things like perfumes in general. You don't want to have that glycerin in because that can aggravate and cause more urinary tract infections. You want to make sure it's the right pH. And there's different ways you can use it with applicators. You can use it just with your finger and apply it to the area outside in that too as well. But these are going to rehydrate the tissue. I don't really like castor oil. I think it's really heavy. I know some women are using coconut oil if you are use organic, but again, I don't recommend that for long-term use. And I don't like Vaseline because it's a petroleum product. So it might be good for a baby's bum, but I don't really think it's good for a woman's vaginal tissue.
Is that something you use just on the outside, or do you actually use it on the inside too?
No, that's what I was saying. So some of them come with applicators. So definitely apply it to the labia, the outside, and then also you can get the applicator and apply some into the lower third of the vagina too as well. So rub it in. You can also apply it around the urethra because that sometimes becomes painful too as well. So it's for both what I would call external use and internal use too.
Are these things, are they prescription based, or are there things that women can buy over the counter?
No, they can buy these over the counter. They're called vaginal moisturizers. You'll see some that have hyaluronic acid in. So hyaluronic acid is something that plumps up tissue. Some women may be familiar with that because they do use it as a facial moisturizer, but there is one specifically for vaginal use too. I think the important thing is that these symptoms they get worse. They will not go away because unless you're replacing estrogen, and even when we talk about vaginal estrogens, I still recommend that women alternate between the vaginal esterizer and the moisturizer. So it's like use it or lose it because those symptoms are going to get worse. And so you need to use those moisturizers on a regular basis, just the same as you would moisturize your face.
Let me go back around to the use it or lose it. What does well, the reason I say that is I see that in the menopause support group is like, I'm sick of having sex, it's too painful. Like, well, you got to keep going or else it's going to get worse. And so when you say use it or lose it, what does that mean?
And I do mean use it or lose it, because the pelvic muscles, and I know you've talked before on this show about pelvic therapy and therapists, those are really, really good for women. But obviously don't force yourself to have sex. One, if the libido's gone, and we're going to talk about that. But if it hurts, definitely. So if you have painful sex, or if you're going to have cramping, or if you've got vaginal bleeding, then absolutely, I don't want you to use it or lose it. It's like muscles, right? Okay, we do exercise them too. And the more you do have intercourse, you're going to increase that lubrication and that too. But first line of therapy would be the moisturizers. Make sure you use a good lube. It may take you longer to get aroused, and because of the changes in the tissue and the change in your hormones. But yes, it has been shown that the more frequently you have sex, then the less it's going to be an issue. But yeah, don't suffer with painful sex. And women suffer in silence for too many things.
Thank you so much for tuning in today. If you want to hear more, we encourage you to revisit these full episodes for even more insight from our amazing experts. And don't forget to join us next week for another episode of the Menowave Lounge, Hot Flashes and Cool Conversations. We're here to support you every step of the way. Thank you for joining us in the Menowave Lounge. If you'd like to connect with Marty, Robin, our guests, or any of our expert Menowave care providers for personalized advice and support, head on over to our website at menowave.org and fill out an assessment that will match you with a provider who knows just how to help. Remember, you don't have to face menopause alone. Our team is here to provide the guidance and care you deserve. So, take that step towards reclaiming your well-being and connect with a Menowave care provider today. Thank you again for tuning in, and we'll catch you on the next episode of the Menowave Lounge, Hot Flashes and Cool Conversations.